Fested, State Secretary to the Minister for Health and Social Affairs, Government of Sweden, Mr. Nicholas Jacobson, Deputy Director General at the Ministry of Health and Social Affairs, Government of Sweden, all the distinguished members of the Swedish delegation, my dear colleague Ashwini Chaubeji, my colleague Minister in Government of India, Madam Preeti Sudan, Secretary Government of India, Health Secretary, and Dr. Balram Bhargav, Secretary Department of Health Research, all the other distinguished guests here, friends from the media. Well, a lot of things have been said till now. I don't think I have any more to add to that, but I'm really happy that for the last 24 hours we are all enjoying good meetings in the company of our very beautiful minister. In the less than 24 hours, this is our third meeting. We enjoyed lunch hosted by the Prime Minister yesterday. In the evening, we enjoyed a dinner hosted by the President of India. And now this is a very, very special, momentous occasion where we are celebrating 10 years of our Indo-Swedish partnership in the field of health. Yesterday we were blessed by the presence of the Honorable Prime Minister of India and also His Majesty the King and Her Majesty the Queen of Sweden, where there was a great innovation dialogue to strengthen our impacts of science for human welfare, of course, health also, because being a science and technology minister also, I feel that if you can really blend the partnership that we have in science and technology and also the partnership that we have in health, we can have far better outcomes. So it's the last 24 hours had been very, very meaningful, and they are certainly going to add a lot of quality to what we are already doing. As has been mentioned by the previous speakers also, and especially our dear minister from Sweden, that this is a unique partnership. My colleague minister from India said we had over 50 partnerships in health, but this stands out as something very, very significant, very, very vibrant, very meaningful, and very much result-oriented, where things are being monitored so well. Every year we have a joint group meeting with Love Agarwal and the team on the other side. They are all actively pursuing all subjects. Yesterday, even at the lunch and the dinner, we were talking a lot about health, maternal mortality, child mortality. I told her that because when we were meeting at lunch, I said, this is the time when I have a bill in the parliament which has to be passed about banning e-cigarettes in India. And at the same time, in fact, I was with her at lunchtime. So after the lunch, I rushed to the Rajya Sabha and we got the bill passed. So today we have e-cigarettes banned in India. And she was very, very positive and receptive about the idea, and she was discussing a lot about what's happening in Sweden, what's happening in India, what needs to be done, how can we really go ahead. And we can now, I think, say that when you go back, you can also try banning e-cigarettes in your own country. So today we are talking of this relationship which is 10 years in health. But while I was sitting here, I was trying to recall my association with Sweden, which goes back to almost 24 years. It was exactly the month of November in 1995 when I was the health minister in the capital itself. And I had a trip to four places, a couple of places in America and in UK and also in Switzerland and of course in Stockholm. And we were planning to visit some of the best centers of occupational and environmental medicine, and we were told that one of them belongs to Stockholm also. And that was the time when it was like shivering cold, ice and snow all over the river, and the whole lake was all total frozen. And when we came back to India in November 95, we were in fact inspired to be instrumental in creating the first environmental and occupational medicine clinic in a medical school in New Delhi for the first time in India. And through the school, now through that department in a medical college, we have trained in the last 25 years hundreds and thousands of doctors in this country for environmental and occupational medicine. Last year itself, around the middle of the year, I had the privilege to again go for a meeting where it was a very, very special privilege that in a day we were attending two functions in two different countries on the same day. Morning function in Denmark, evening function in Sweden, and because both of them are so close to each other, and it was a mission innovation meeting with a clean energy ministerial, where you all know that at the Paris meeting for global warming and climate change, this mission innovation movement was born. And our own Prime Minister Narendra Modi, had coined this word mission innovation, where the scientists from almost 24 countries, the European Commission, they are all working together to find out newer ways of, you can say, having clean energy research and developing new incubators for clean energy research. And for the first time, in fact, we have created an international incubator for clean energy research in New Delhi itself, in northern part of Delhi, from our Science and Technology Ministry, where scientists from all over the world, they can all participate in that. And India is fortunately part of all the challenges that the mission innovation is working on, with leadership role for at least three challenges there: the smart grids, off grids, and biofuels. So it's a very, very important moment for me. Is again with all the Swedish people. I know that you are all very nice people, very kind-hearted, very loving, very affectionate, very sincere, very polite, very dedicated to your work. So I know that this is not a routine meeting, but this meeting means a lot for us, because for us in health, India is passing through great times. We have fortunately a very, very dynamic and a visionary Prime Minister who has passion for everything that in fact helps mankind, helps alleviate the sufferings of the common people. But he has a special passion for health issues. He has a special passion for science and technology issues. He has a special passion for innovation, and he knows the power of innovation. He appreciates the power of science and technology, and he knows that unless we strengthen health and family welfare, we can't really help people in a big way. So there are a lot of big activities going around in the field of health in this country. You all know we have already eradicated like the most of the world diseases like smallpox and polio, and now we are in the process of eradicating and eliminating a number of other diseases like tuberculosis much before the targets set up by the World Health Organization, diseases like Kala Azar, lymphatic filariasis, measles, and so many others. We are in the process of actively ensuring that we reduce our maternal mortality and the child mortality rates to bare minimum, and every preventable death of child or an infant or a pregnant mother has to be prevented at every cost. That is the spirit with which the country is working. You have heard from our colleagues about the Ayushman Bharat, one of the most ambitious programs of the whole world, where we thought of helping almost 550 million people with so much of support, financial support, and healthcare delivery delivered through over 18 to 20,000 hospitals all over the country. And already in the last 1 year, we celebrated 1 year completion of this very ambitious program. We have almost 60 lakh, that means 6 million people have already benefited from the scheme. You heard about our ambitious program for the health and wellness centers, where we intend to provide these 1.5 lakh centers by the end of 2022, and already money worth $1 billion has been spent on the care of these people who are given the service through these centers. There is a big movement around prevention and positive health attitude development, promotion of health being strengthened, and preventive strategies being strengthened in this country. There is a strong Fit India movement which has been conceived and is being spearheaded with a number of ministries, and of course our own ministry along with the sports ministry participating in that, and also an Eat Right India campaign, where we are promoting that if you eat right and if you eat less, you live longer and you remain healthy. So it's a huge, I think, basket of things that's in which we can further expand our relationship. It's not that what we decided to work together 10 years back, we continue to work in those areas. This relationship has to be continuously dynamic. It's now we are talking of collaboration with 2 aims, but right now almost 22 aims are in the process of development at various places in the country. 157 medical colleges are new medical colleges are in the development phase right now in the country. So there is a huge expansion of the network which provides medical education, whether it's undergraduate, postgraduate, and at different levels. A lot of activities going on in the field of research, a lot of collaborations with the scientific community, with the engineering community for development of cost-effective, affordable medical devices, for the discovery of new drugs, and for the delivery of all these drugs and medical devices, etc., at affordable prices through our, you can say, organized government shops, which we call as Amrit, and with other names. So it's so much that's happening in India, and I think with the experience of other countries, and more particularly Sweden, we can be of great, immense help to each other. And certainly it's the goal not only for India, but for the whole world, which was dreamt of by the World Health Organization, that we have to fulfill the dream of giving a health for all, to not only all Indians, but to every person all across the globe. And if we all work together with sincerity, commitment, and dedication, I'm sure with the support of the organizations like the World Health Organization and other international UN organizations, and with cooperation from various countries, I think time is not far when we will be standing at a platform where we can look back and say, oh, we have achieved quite a bit. Now the goal is not too far off. So we must go back from this meeting with a new sense of responsibility, new sense of commitment, and a new zeal and energy to do far more, I would say, significant things in the next 10 years than what we could do in the last 10 years. Occasions like this, I think, are the moments when we could reaffirm our faith in each other and also plan for the future. So with these few words, I once again welcome our dear minister, our dear colleagues, and all the members of the Swedish delegation. And we assure all of you that India stands rock solid with you in our desire to work together with complete dedication and sincerity. Thank you so much.